Hi everyone, welcome back to my channel. In this video, we're going to talk about one of the biggest myths in regards to lumbar spine disc bulges. Many of you guys who experience lumbar spine disc bulges has been heard or read or been told from their physician to avoid one particular movement while they're experiencing this pain. That one singular movement is forward flexion or bending forward. However, it is totally fine to minimize that movement in a very acute phase of your injury, but patients end up carry on with that habits after acute phase and consistently preventing from doing this movement over a longer period of time, which means they're chronically trying to avoid bending forward and they end up having a very straight posture or sometimes over straight, which means really tensing their muscle in their back even while sitting, standing, walking, and so on. I'm going to share with you two important tips that can help you to get a better understanding in regards to lumbar spine disc bulges and why you shouldn't avoid forward flexion for prolonged. And at the end of this video, I'm going to share with you a couple of movement and exercises that you can start doing from a very basic level of movement of flexion and gradually build up this movement. By following these exercises, I can guarantee you, you will have a better confidence and coordination and strength in regards to your lumbar spine. And specifically, if you're suffering from lumbar spine disc bulges, this is the must for you to follow in the day-to-day living. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe to my channel for my weekly update and don't forget to press that like button. Let's get started. The first issue with not bending forward or flexing your spine and maintaining a good posture, which means very straight, look good but pretty stiff, is that you chronically overusing those muscles in your back that they were not supposed to be held on for 8 to 10 or 12 hours daily. The muscle in our body has this rhythm that they are all either on or off, and they're not meant to be on all the time. If you chronically, repetitively holding those muscles in that position and not bending forward and letting to relax as well, you end up very stiff through the day. Even while you are sitting, you can't really relax those muscles anymore. And second thing is that you end up lose that coordination of the muscle, which means have a control of to relax them and then tense them. They end up in that spasm or tense position all the time. This is one of the most common reasons that you end up going to getting a massage or treatment or getting manipulation or different type of manual therapy, which can give you a very short window of relief, and then you go back to your routine and habits and stiffening up your back, which means if you do not stop relaxing your back and breathing and bending forward gradually, you end up losing coordination and staying stiff in your lumbar spine. The second problem with not bending forward and using the forward flexion in your daily routine is that you can cause hypersensitivity or chronic pain in your lumbar spine. By holding your spine in that position and holding your back in a very stiff position, your nervous system becomes much more alert and aware of your lower back and upper back, and it pay more attention to it. And whenever you are going to utilize any movement that bring your body to forward flexion, accidentally, your body going to overprotect and cause spasm in your lumbar spine. This is one of the reasons that people constantly getting back spasm, because they do not getting a right technique or answer in regards to their recovery, and they constantly protecting their lower back. Whenever they get pain, they go get a massage and they end up repeating the same cycle and cause chronic pain in the long run, which means if you repeat this cycle a couple of rounds, you end up with chronic lower back pain, which can be a pretty messed up situation. Why? Because you start to feel pain in any type of movement that you do. Even sometimes if you're sitting, you're still gonna feel the pain. However, there's not much damage going on in your tissue, but your nervous system highly aware and hypersensitive in regards to your activity. These two reasons that I mentioned to you today can hugely help you in your recovery. If you're suffering specifically from chronic lower back pain due to disc bulges, you need to understand that disc bulges heal by itself over time, but the pain can stay longer based on your daily habits. These daily habits that I explained for you today can hugely help you to understand what you need to add on to your routine. And I'm going to share with you now a couple of movement and exercises from a very basic to advanced that you should start to add on to your routine if you want to see results. Let's get started. All right, guys, the first move that we're gonna do is gonna be prone position hip flexion, which means you're going to lie on your back and bring one knee down to your chest. We're not doing full flexion yet. We are trying to prepare your body for that movement. This is the opposite movement that we can do. Rather than flexing forward, we're gonna bring our hip down to the belly, which is kind of like create the same movement. You start with a single leg and then you bring both legs and hold them there. Breathe in and out. You can do a bit of rocking movement there if you can, if it feels comfortable. You can stay there for 10 to 15 seconds, 20 seconds. Breathe in a comfortable range. Make sure that you're breathing and you're relaxing your back. This should be a very relaxed position. You're going to start this routine with this exercise, and by practicing this movement, you're giving a bit of stimulus into your lumbar spine that actually you can flex down. Now, this exercise should be done gently, which means go within the comfortable range that you feel comfortable. Practice it daily, 2 to 3 times through the day. You can do it even in bed, when you wake up, before you go to bed, and try to repeat these as often as you can. The next move that's gonna be done in this routine is gonna be seated hip flexion, which means you're going to do the same movement in a seated position, which means you bring knee down to the chest. I'm gonna show you from the side angle as well. You get a view. This helps your body to relax, and you're going to bring the knees up. You do it in a single leg. Hold it there for 15 to 20 seconds, 2 to 3 times through the day, as often as possible, the better. I'm gonna show you from the side, which means you're gonna relax your back, bring the knees up, hold it there. You can use the chair as a support even at the start if you find it difficult. Stay there for 10, 15 seconds. Make sure that you are relaxed and breathing. You're breathing basically, your shoulders are not here. Down, breathe in and out, and let it to relax there. The more you do this exercise, your lower back feel much more comfortable by utilizing those muscles that has to be doing the full flexion. Try it and make sure to focus on your breathing and you're relaxing your whole body. We're going to progress this exercise to standing hip flexion, which means you're going to be using a wall as a support and you're going to bring one knee up. This gets really your hip and your basically deep glute muscle, a bit of stretch. You hold it there for 10 to 15 seconds. This can be challenging if you haven't done. Go within the time that you feel comfortable. You can rotate the other side. Same thing, you don't want to keep your back straight. Relax the back. Let your body to get used to this movement, which means that flexion. Now, we are working against gravity, which means you have to hold this tight. Hold it there for 10 to 15 seconds. Couple of rounds through the day, and whenever you felt you can hold it longer, challenge it to 20 to 25 seconds. All right, guys, now by doing those 3 first exercises, you're building up that mobility and movement in your lumbar spine and your hip, and it kind of ease off your body to do more. Now, gradually you can reintroduce forward flexion in a seated position, which means you're going to relax your back, hold your hands next to your shin bone, and gradually lean forward to the point that feels comfortable. Make sure that you don't want to overstretch it or overdoing it. Go within the range that feels comfortable, and you have to be able to drop your shoulder down, breathe in and out, and come back up. You want to hold it there for 10 to 15 seconds. Repeat the same thing once or twice at least through the day for 3 to 8 repetitions. All the way down. Take a deep breath in and breathe out. Slow control back. I'm going to show you from the side. You basically can do this in a dining table, when you work in the office, a couple of rounds through the day, whenever you had a break, slowly lean forward, within range that feels comfortable. You will feel some sort of stiffness and tightness around here, but the earlier you do these and challenge yourself, the better it is. You can practice this exercise for 3 sets of 8 to 10 repetitions as often as possible. Make sure that you're breathing, you're relaxing your back, and don't overstretching it. All right, guys, the last move that I'm gonna share with you in this routine is gonna be child pose or baby pose movement, which is kind of like a progression. When you get more comfortable with your back, this can be an easy movement for you to do, which we're gonna basically gradually start in a seated position. If you find here is not really comfortable, add some pillow or towel underneath of your ankle or your basically back of your thighs to get comfortable. You can gradually lean forward to the point that feel comfortable, which means you're leaning forward, shifting the body to the right and left, breathing in and out, and gradually you lean forward when you feel comfortable. The goal of this movement is to be able to breathe in this position and fill up your muscle, which means that you have in your lumbar spine with air. Your diaphragm can really expand this muscle and get your ribs out. You want to really practice that movement while you're doing this movement. You want to take a deep breath in and breathe out. Try to stay relaxed in that. Now, and somehow your ankle mobility can really challenge you in this position. You have to practice this over time with maybe 5 to 10 seconds gradually and build them up to 20 to 30 seconds. Practice this exercise maybe in bed because it's more cushioned and comfortable, and you can give it a try in the morning when you wake up and before you go to bed. Thank you for watching this video. I hope you find this video helpful. If you have any question regarding to your injury, or if you have any suggestion, leave me a comments. If you haven't subscribed my channel yet, make sure to subscribe and don't forget to press that like button. Until next video, all the best.